Hi, welcome back to Student Nurses Success. Today we're going to talk about renal function and renal disorders. Before we get into the actual renal disorders, I find it helpful to go through some background information about the categories, general manifestations, and laboratory values with regard to renal function. So here's our blank map. And remember, you can find the link to the maps in the comments section. Let's go ahead and get started. I'd like to first begin by talking about the categories of renal disorders. Renal disorders can fall into three categories: prerenal problems, intrarenal problems, or postrenal problems. We're talking about prerenal problems. We are very specifically talking about issues that reduce blood flow to the kidneys. So, any type of disorder that's going to alter circulation to the kidneys can result in a prerenal disorder. So, these have to do with circulation and blood circulation. Things like renal artery stenosis, general decreased renal blood flow, decreased cardiac output, such as what happens in a myocardial infarction. And in fact, myocardial infarction is a common cause of pre-renal problems. Decreased blood pressure or hypovolemia, anything that reduces blood volume is going to reduce blood flow to the kidneys. Burns falls into this category because with burns, patients often become hypovolemic. Now, do not underestimate the effect of these things on renal function. And in fact, often with pre-renal renal problems, we're looking at usually the cause of acute renal failure. Now, intrarenal problems are issues that affect the actual kidney function and filtration. So these are disorders within the kidney. Things like polycystic kidney disease, pyelonephritis, which is a kidney infection, glomerular nephritis, nephrotic syndrome, drug nephropathies or medications that can actually harm or hurt kidney function, and even tumors related to the kidney. Post-renal problems are issues that have to do with obstruction of flow of urine out of the kidneys. So, how pre-renal had to do with blood circulation and blood volume, post-renal really has to do with the backup of urine itself into the kidney system. What happens with postrenal issues is when urine cannot flow out, it starts to back up and it causes hydronephrosis or swelling of that kidney. That swelling or that hydronephrosis actually starts to crush and damage the kidney structures. Things like vesicoureteral reflux, nephrolithiasis or stones, benign prostatic hypertrophy, maybe urethral strictures, and tumors can also cause these issues. So these three pictures are meant to kind of help you. This one is supposed to really identify blood flow as the issue of pre-renal problems. Intrarenal is actually something wrong with the kidney itself. And post-renal has to do with obstruction of urine flow out of the kidney. Now, these disorders are all going to be covered in subsequent maps, but just to kind of tell you where they fall into the categories. Now, let's cover some of the general manifestations of disorders. The best way to approach this is to first think about what do the kidneys do? And if you know what the kidneys are responsible for, then when they're not working, it makes it pretty easy to identify what the manifestations are going to be when they're not working. First of all, what we generally see is oliguria or decreased urine output. Remember, you need 30 mils an hour of urine as your minimum. So when we start to see a decrease in urine output, these are issues related to the kidney. Blood in the urine. Sometimes we see hematuria or blood in the urine with some of our disorders. Blood in the urine looks amber, maybe Coca-Cola colored. Protein in the urine or proteinuria will make maybe pale, frothy, bubbly urine. When the kidneys are not able to hang on to the protein and protein is falling through into the urine, that's a sign our kidneys are not functioning well. We know that our kidneys are responsible for making erythropoietin. And so, if there's kidney damage or kidney problems, we start to see a decrease in this erythropoietin, which causes a decrease in your red blood cells and results in anemia. Now, your kidneys are also responsible for the conversion of vitamin D, which is necessary for the absorption of calcium. So, when the kidneys are not functioning well, we see less vitamin D conversion and we start to see overall blood calcium levels decline. Kidneys are responsible for filtering waste. So, when they cannot do that, we see azotemia, which is a buildup of waste in the bloodstream. We see an increase in blood pressure and hypertension when the kidneys are not functioning well, and that's usually because the RAS or the renin angiotensin aldosterone system is starting to really cycle up. And we know that kidneys are really responsible for getting rid of some of our potassium and our magnesium. So when we have kidney problems, we see a rise in potassium and magnesium levels. We see metabolic acidosis develop when the kidneys are not functioning well. And then, as far as pain, we may see generalized pain, flank pain, abdominal pain. So, these are all manifestations to keep in mind in patients who have renal disorders. Let's talk about our important lab values. Now, these will be altered in kidney function. When the kidneys are not functioning well, you will see a rise in creatinine levels. Now, your kidneys are responsible for filtration. And so when they're not working well, you actually see a decline in GFR or filtration. So good kidneys have a higher GFR. Kidneys that are damaged or hurt have a lower GFR. When your kidneys are not functioning well, you will see this rise in BUN. If you are making concentrated urine or decreased urine output, often we see a rise in specific gravity. We may look at urine cultures to identify urinary tract infections. We can look at urinalysis to identify if there's CAS, red blood cells, protein in the urine. We can also see nitrites, which are the byproduct of bacteria. So that would signify some type of infection or urinary tract infection. And we can also monitor specific gravity and urine pH with urinalysis. Now, it is important to remember that GFR and kidney function naturally decline as we age. That's just kind of what happens. So, as we get older, the creatinine does tend to rise a little bit, and GFR does tend to fall a little bit. Young children also have a decreased ability to concentrate urine, especially when they're infants. So, they tend to dehydrate much quicker than even when they're 4 or 5 or adults. So I think that's a good summary of renal function as far as the categories of disorders, general manifestations, and important lab values. Make sure you check out some of our other videos that will talk about the actual renal disorders based on intrarenal, postrenal problems. Thanks and have a great day.